Alright, so want to actually talk about candidiasis. So it's more of like the classification of candidiasis, and this is based on the timing, like how long has the patient actually had the infection, right? So candidiasis is that popular thing that you see people usually calling it yeast infection. So classification of yeast infection based on how long the infection has been there is what is actually the acute, the subacute, or chronic candidiasis. So for this one, you see this is yeast infection. It could be the genitals, it could be on the mouth, it could be on the skin. Okay, so the candidiasis that is an infection caused primarily by the a type of yeast known as the Candida albicans. So though other species like Candida glabrata and the Candida tropicalis can also cause it. So it can affect different parts of the body, like we said, genitals, mouth, skin, the other side, and even nails. Okay, so classifying it into the acute, subacute, and chronic, we are just trying to talk about the duration and the severity. Okay, so acute one is the infection is coming all of a sudden, it's intense, it's sudden. So you have redness, swelling, intense itching, thick, okay, or white cord like discharge, so everything is all of a sudden, okay, in the acute candidiasis. So triggers, maybe you have been using antibiotics, so the antibiotics mistakenly killed the good bacteria, so now you are now left with the bad bacteria. Okay, high blood sugar, so you have diabetes too, you are immunosuppressed. Okay, so mainly treatment is antifungal creams or oral antifungal drugs. For the subacute one is gradual, do you understand? And everything coming up is less intense than the acute. This one is just after acute. Okay, so there's mild discomfort, there's intermittent itching and burning, that means it's coming and going, and there's pronounced discharge. Okay, so it's often seen in early stages of the infection, maybe if your immune system is not that strong, but at least it's strong to keep you going for a little time. So treatment is similar to acute. So for the chronic candidiasis, this one it has been persistent. So you have had the infection from weeks to months. So the infection is usually resistant to treatment. Okay. So, and of course the infection is eating deeper into your tissues. Okay. So associated conditions, maybe the person has HIV. So there's like weak immune system, you understand? Maybe diabetes, maybe you have used corticosteroids for a very long time. Then chronic mucocutaneous candidiasis. Okay. So treatment is, of course, you have to recoup more, right? So extensive antifungal therapies. Address any underlying conditions, and you can now use systemic fungals, antifungal drugs, right? So instead of just rubbing the drug directly to the infection, you can now just want to put it into the whole system. So that's it for the classification of candidiasis, and this is based on duration and severity.